You're listening to the Physio Matters podcast in association with Choose Health, and this is session 41. Back to the Physio Matters podcast. I'm Jack Chew, and we've been doing with lots of fun stuff going on over at TPMP HQ. We've been starting to run a few more events. Attend a few more events. We've not been running them. That's a lie, straight out the gates. We went to the Physio Research Society and to British Rheumatology Society's annual conferences, and we did some live streams. So head to our Facebook page, the Physio Matters podcast on Facebook, and you'll find some live feeds from there, from two events simultaneously. We're on the same day, so we're trying to coordinate that. A little bit of a tester for us to try and do a bit more events coverage. If you like what we do and you'd like us to be at any event that you're involved in, or if you're even just a member of a society that runs a conference that you feel would be good for us to go and broadcast from and interview and try and take the conference out of the room, then please let us know. We'd really appreciate your support, as well as just bringing our work to the attention of the organising committees if you sit on them or if you're involved in them. So please do let us know, because we'd love to get out and about more. We've got a couple of new setups really with the live stream kit, so we can try and get ourselves out there more efficiently with top quality sound. Other things we've had going on. Jack March ran the TPMP Champions League, which was he set up a randomised league table of different podcasts over the years for our 40th podcast anniversary, and it was really interesting. Got thousands upon thousands of votes through the days that he ran it, and it led to a final between Ian Griffiths and Greg Lehman. And so two really popular podcasts had a big fight out in the final, and I think with 62% we had Greg come out as the winner. And so what we did is we then planned that we put it to our patrons that there's going to be some exclusive content available to them for either just with the winner, Greg, or with Greg and Ian. And we asked them which they wanted, and they chose for Greg. And then we said, do you want that as private material, or do you want that to go public? And they said, put it out publicly. So, really hats off to our patrons. They had the choice of keeping something to themselves for what they pay for, or share it out widely, and they unanimously voted for it to go out widely. Unfortunately, we couldn't get Ian on the call just because we were on tight boundaries for time, but we will make sure that conversation does happen. I think it'll be an interesting one. But instead, what it meant was I had a chance to catch up with Greg and try and go into areas of conversation we haven't deviated before. People will have known that we did a podcast with Greg back on session 16 or 18, I can't remember. I should check that, really. I don't know why I don't, but I'm doing this ad lib. And it was a really popular episode, as I mentioned in this session. But what I wanted to do in this is try and touch on some areas we didn't cover, and try and poke into some areas in which we might even have disagreed. Turns out we just don't. I mean, despite best efforts, I couldn't find a way to disagree with the bloke. He's a phenomenal thinker, and a really, as I mentioned throughout the podcast, someone that I have massive amounts of respect for, just for the way that he approaches debate and discussion, and always got massive amounts of patience, a lot to learn. I've learned a lot from him. I will continue to, but I imagine that everyone else can. I think he's a sort of stand-up example of how we might be able to try and win the battle of ideas, as I keep pitching it. Is thank you to the people that got in touch regarding some mentoring. We're still in discussions over where those slots go to. So if you're interested in being mentored by me or the team, then please let us know, and we'll talk about that a little more, as well as thank you to those that are starting to send some patients our way. If you have any patients, particularly in and around our new clinics, which are in Altrincham, Cheshire, so anything in the real northwest region, especially if you've got some second opinion stuff, that might be worth travelling. But if not, then we're in Altrincham, which is just south of Manchester, and also into Norfolk. We've got clinics over that way now. A clinic that we're running out of a gym there as well. So if you've got any patients that you feel you want our style of approach placing upon them, or you've got any friends and family that you want to point in a direction, then if you were to consider us, that would be much appreciated. And of course, if you were to find a way to become a regular referrer, we'd find a scheme, and we could maybe even throw you some extra goodies and bring you onto the Patreon sort of Patreon system, I'm sure we can manage something like that and get you some exclusive content as a thank you. But we appreciate it either way, which way it comes. But anyway, enough from me. I bring you the man himself once more, Greg Lehman of the, well, we're going to go with Dr. Greg of the Lehman Institute. And if you've not heard that banter before, then eventually, if you listen on, you'll get the big reveal as to what that means and why he's now going by that alias. So I'll see you at the other side. So I'm delighted to be back on the air, not in person this time and not in the pub this time, which is only disappointing in both ways. But with Greg Lehman, who was our first. I've got a few stats to open with. First guest of ours to breach 30,000 listens on the Physio Matters, and since we've had a couple of episodes recently that have gone crazy. Neil Langridge and Anina Schmid's episodes. I think even Toby Smith's episodes have then overtaken it just about. But generally speaking, certainly a massive box office success, I can say. And the ideas that he then talked about have become a real common theme since then. Can't believe it's nearly 2 years ago since we had the first chat, Greg. And we'll talk about how things might have tweaked and changed and shifted. But since then, we were just joking off air and saying that you've probably been on as many podcasts since then as I have. So you certainly should. You're a pro when it comes to this stuff now. We won't go over too much old ground, and we'll try and make sure we cut onto some more edgy stuff. And I'll point people towards both our podcast together as well as many others that you've done in the show notes and things. So to move things forward. We've got a few questions, and I'll try and walk us towards the subtle disagreements that you and I have, although admittedly there aren't many of them because I'm just a bandwagoner. But generally, is there anything new you want to tell the listeners about you in the last 2 years?
Remember the last time we were running, we're going for runs and puking. I'm hardly running anymore. I have new goals now.
Then I knew Greg the runner, and now I know Greg the daddy gymnast. Do you still end up telling your course participants about me puking on Brighton seafront when we went for a run together? Is that?
I think I just had to make it relevant, right? That were you there when I? Yeah, you were there. I had to. I don't want to talk about you like behind your back.
It's okay. No, it's fine. You talk to me.
So I feel like telling the story next time on a course. I have to pull you up on Skype and then tell the story.
No, it's fine. You chat away, mate. You won't be the first. There's plenty of anecdotes that can do the rounds about me being on not loads of vomiting stories. I think in the physio world, but there's plenty of daft ones. But generally, there's I'm sure a few corners of things that I've seen you walk towards that might have been some changes in your thinking or adjustments. But otherwise, you now apart from the backflipping, has your work circumstance changed? Are you doing anything particularly new with regards to sort of physio and the like?
Yeah, I'm trying to get back more into research, primary research. Right. That's the goal now. Just to keep teaching a little bit, keep seeing patients. We're just renovating our house, the basement, but to put a clinic in the basement. That's what's going to be exciting, and then start doing more research again.
Brilliant. No, that'd be good. And do you think that you will rekindle some old research flames, or do you think you'll try and deviate into something completely new?
You know, I've mentioned this before, but what I want to do is again simple biomechanics stuff, with the idea of like the whole point is I like to do biomechanical myth research just to say like don't worry about this stuff anymore. You know, it's because what happens is, you know, if we want people to move on and do the psychosocial or biopsychosocial, we have to give them a reason to move on. So you have to give them an alternative, you know, of how they can practice differently. But at the same time, you kind of have to say, you know, these things that you're saying, they're not well supported. And so maybe we have to get away from them as well. So I want to do like really, really basic stuff that wouldn't get any funding because they don't need funding. Because the payers would be like, well, who cares that reciprocal inhibition doesn't work that way? Just because your psoas muscle is tight, it doesn't mean that your glute muscle turns off. Like a study like that, no one's going to fund that. But that's such a dominant theme in our profession, right?
Sure.
And these are, and so I believe in testing that stuff, and then we can kind of move on from those ideas that don't have a lot of support and aren't even like really biologically plausible
Not even
either.
making sense in theory, are they? But that's great. And I think what I'm going to try and do is probably postpone that for a moment as to whether that would truly blow the lid off the dogmas that exist, because I think that the different ways in which we try to translate that material, even if we had the most robust of data on that, is that sufficient to really plant new seeds? We'll come back to that a little bit, because I think that the common thing would be no, not alone, but we'll come back to that if you don't mind. But it does remind me of something else you've been it's certainly an extension of an old theme, but you've been talking a little recently, and probably even when we spoke, was even in any supposedly neutral squat, you still get spinal flexion. So this idea in which we spare the spine, not only is that a myth that it needs to be busted in terms of it being particularly inherently dangerous to flex the spine under body weight or under load, but also that even the best attempts to spare the spine of if you don't mind that phrase, or to avoid spinal flexion, it still does show a degree of lower lumbar flexion anyway. And so is that the sort of thing that you might find yourself wanting to do some primary research on once more?
Yeah, exactly. So that specific study that we want to do, I've just been playing around with a little piece of equipment on the course and with volunteers, but we'll do it more robustly, is measure spine flexion during squats, compare it to other activities, and then sort of see if anyone can actually look at the spine and how it moves and say, is that in neutral or is it flexed or not? Because one, I don't think that people are very good at seeing it. And then two, if we document that you can't actually avoid spinal flexion, this is lower lumbar spine flexion, sure. Then how important is it? Because what end up happening is there's no doubt that people feel better when they, like, say it hurts to bend their back forward when they lift and lift predominantly through the spine. And then, you teach them how to lift with a hip hinge and they have less pain. It may not be because the spine is flexing less or it just, or it's flexing less, but it's just a little bit less, it's not going to end range. It's not that it's out of neutral or anything like that. It's just that it's different, or you're putting more stress on the hip or something like that. So it's a touch academic, but it's just simplifying things as well. It's sort of saying, like, the implications for primary prevention are more important. They kind of say you can just lift whatever feels comfortable, get your hips involved and don't fully round out your upper back. Because that's what I think is what's happening. People round out their lower back all the time, but it looks like they're in neutral because their upper back stays relatively straight.
Sure. No, I think it's the excessive attribution of cause when someone makes a gain or improves a pattern by it being less painful. They'll attribute that gain not to a change in habit, but to a change in biomechanics that's supposedly towards a more neutral or more optimal loading position.
Yeah.
When really
exactly.
that's just that they've taken that clinical anecdote and they've attributed the cause, and also it's a very intuitive reaction for a patient to attribute cause. It's a very simple causal relationship between a habit change and then symptom reduction is then to look to the postures, mechanics and tissues on a level. Not that patients always then take it to physiology, but generally they can understand that, okay, I've just changed the stresses that go through it, and therefore that's doing less mischief to me because pain equals damage. It's a very straightforward line that people can draw, and sometimes they don't even verbalize that unless they're asked. So that makes sense. Okay. And it also takes me to where I'd love to go with this, because you've written on this as well as spoken on many of your podcasts, including ours, on this. But you do like to give credit where it's due. I've always found that a really appealing way in which you go about things. You want to look at the whole argument, not just the weakest components of it. When you're sort of finding yourself positioned against an argument or an idea, you would want to see it in its strongest form. And I think that usually makes us fellow travellers. I want to give credit where it's due. one of the things that we're talking about already is spinal sparing, the idea of not finding yourself loading the spine in flexion, the idea of spinal neutral being optimal into a squat or into a deadlift. Now, if we can, it's your fellow, your previous mentor and someone you've worked closely with, someone like Stu McGill, would make a case for not loading the spine into flexion. Can you, before we talk about, I mean, we've already touched on why that's not really in line with what you or I feel is sensible or plausible even, but can you give us what is the strongest case for someone like Stu's position on this?
Oh yeah, absolutely. I still agree a lot with Stu. I really like how Stu approaches patients. It's just again, you talk about attributing cause. He probably just has a different view of what's going on. But what I think Stu would say, and you have to fully understand how he got to his reasoning, because he created the knowledge base. That's what's so special about Stu stuff. Like they had a research question 20, 30 years ago, was how does the disc get damaged? You know, how does it herniate? And they showed a proof of principle in a porcine, a pig cadaver spine. If you load it in neutral, and other people were showing this, if you load a spine in neutral, the disc won't herniate. So they're like, well, how do we create herniation? It's repeated flexion under low loads. They showed that the disc will delaminate and herniate. And then Stu went on to show, people would say, well, not everyone. I have a cousin who could do tons of sit-ups. And Stu would say, well, this is why I can do tons of sit-ups, because there's a certain type of spine. Like I always get it wrong, but I think it's like a lemicon shape, or maybe the vertebral bodies are very narrow, and they actually tolerate flexion really well. So Stu went on to show, well, this is why there's exceptions there. And then Stu's research would show when you model the spine, when you lift with a flex spine, or a more flex spine, that there's more shear force in the back, and that the disc has more strain. So you both have a cadaver study, like a tissue-based study, and a biomechanical model-based study showing that the disc can wear down over time. Sorry, speaking so fast. The crux of all that argument, and this is where people start to disagree. So everyone, I would totally respect all that research, and everyone has to respect that. And then the issue here, and 20 years ago we might have known differently. The question is, how well does the disc adapt? That's where we're at right now. So if the disc doesn't adapt very well to the stresses we place on it, then maybe we want to avoid how much we load it. Like we would do with a muscle. We wouldn't load a muscle every day to its maximum. We'd say there's a certain amount that you can load the muscle and adapt. So everyone recognizes that adaptability is finite. And we probably recognize that adaptability is different depending on the tissue, right? That's why people probably have more tendinopathies than they do have muscle strains.
Sure.
Right? Because the tendon is a little bit slower in adapting to repeated stress. So then the question is, same with bones and bone strains and stress fractures. So what is the disc? How well does the disc adapt? And that's the crux right there. If you think that the disc adapts really well, then you probably don't care too much about repeated spinal flexion under load. If you are worried about the disc adapting, and you don't think that there's any way to know that the disc isn't adapting properly until it's too late, would be the idea, then you might want to say, I think we should minimize repeated spinal flexion. And I think that's where Stu comes at it. So it's really, that's the crux to me, where people disagree there.
Sure.
Does that make sense?
It does, and that's exactly it. There's an awful lot of.
And we don't know. That's the problem. We don't have animal models. We can't really study people that well. We don't have enough studies that look at humans, like in the long term, to see if someone has repeated spinal flexion, what happens to them 10, 20 years ago versus a sport where there's less spinal flexion. Except for that paper by Foss. We talked about that 2 years ago. With the Norwegians and the cross-country skiers versus the orienteers. But other than that, we don't have much.
Sure. So. Now, when it comes to, and I think that's exactly why I was asking that question, is because there's a lot of underlying stuff. There's the people that are too quick to completely, dismiss and at worst ridicule some of the underpinning work in which he built the knowledge base. There's no lack of reasoning behind that. But we're and neither of us are going to go near that. But also, there is then a an element that I have a recent frustration with, where I don't feel he then necessarily will offer the same charitable reading of the counter argument, and I don't see him then incorporating or offering a coherent argument against the idea of a more adaptable and then robust system, a complex neurological picture in which we know that there are some central processes that need to be acknowledged. And that has caused me personally some problems with regards to me trying my best to explain this to layperson journalists in the UK, who then drop me an email saying, do you know that this is counter to the most sort of renowned spinal specialist in the world, Stu McGill, who says that what you're talking is nonsense? It's frustrating for me to look on at his work with respect and to pass out the things that I agree with and disagree with, only to find out that a biomechanist is still what it seems to be reducing someone to its constituent parts and seeing it as being a truly mechanical entity, and talking a lot of stuff when he's translating it onto patient care does seem a little bit backward, and it doesn't seem that the nociceptive structure failure model has really served us that well. It does seem a little regressive to me. So that's where I start to find myself frustrated with although renowned man who still speaks many things that are sensible. That's where I find myself deviating from his argument.
Yeah, I think Stu is probably focusing on a certain type of patient that he sees. Right, and then might have more difficulty with a patient that has a different type of pain profile, where there's other contributors going on there. You know, we're all just products of our environment.
I think that's right. I think one of the things as well is that especially with that magnificent mustache that he has, I don't think that there's many people that are going to deny him a bit of time to look at their movements and to scrutinise and to put them under various measures and machines. So there's something compelling about the fact that he might actually get somewhere with the idea that someone might have a persistent problem that is somewhat centrally sensitized amongst other pain mechanisms, put them under such scrutiny with the attention and the level to detail, and then giving them an idea that completely colludes with how they've long time seen themselves, especially those that have rejected a more, shall we say, airy-fairy approach where someone's looking at their sleep patterns and then someone turns up and says, no, actually, it's because you're moving badly. I think that's incredibly attractive. I bet he does him brilliantly, but I can look on and see how he helps people. I'm not sure, not that we've ever had a back and forth, and maybe we will have him on this podcast one day, but if we have a back and forth, I'd love for him to try and explain as to how I help anyone.
Yeah, so to be charitable, Stu, what I think he does well, and I'm actually going to draw a parallel to him with Peter O'Sullivan, because I think in some cases they're very similar. So let's say we loosely and crudely categorize patients as avoiders and as like endurance copers. Yeah. Right. So endurance coper is the person that keeps doing the thing that aggravates them and they don't realize it. You know, and that could contribute to central sensitization because of the long-term potentiation and blah 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 blah, and then they stop, they aren't doing the things that they enjoy in life. It could be lifting weights, it could be playing baseball, it could be throwing something. And so then they go and see Stu, and he pays attention to them for 3 hours. And this is, if you look Peter O'Sullivan does the same thing. It's just a different approach. They both look in and say, okay, what is the thing that hurts that you do when you look at them move? They both find the patient's movement habits, right? They'll both, O'Sullivan will say, every time you bend forward, you hold your breath and brace. Does it hurt? Yeah. Well, why do you do it? So he goes into like their beliefs about why they're doing it. But the same thing, the person is endurance coping. They keep doing the same thing that aggravates them. Stu would say, look at someone and say, every time you squat forward and get out from a hands and knees position, your spine goes into flexion, and that hurts. You keep showing me that it hurts for you to bend your spine. So Stu will come at it via stability paradigm. And he'll suggest, listen, you can't control your spine. You keep doing the thing that aggravates you. I'm now going to give you these exercises to improve your ability to control your spine because it's unstable. You're going to avoid doing that thing that picks the scab. You know, now I'm going to teach you a way that's spinal sparing and hip hinging, and now it doesn't hurt. And there, we've helped your problem. You can start doing the things that you want to do again. Pete will do the same thing. if you look at their papers, like with JP Canero on the rowers, or their papers with Angus Burnett and Mitchell in the Aspetar Sports Medicine Journal, they find someone who's flexion intolerant that rows. They say, you know what, for a little bit, let's teach you to bend more at your hips when you're rowing. When you do a deadlift, you're going to do a more of a hip hinge pattern. But and then go into why they're doing that. They'll talk about the other contributors to it. It's a slightly more comprehensive, but the mechanical component of the treatment is almost identical. It's just explained. You have a movement habit and you're aggravating yourself. And if you saw Pete 2 or 3 years ago, well, I was surprised when I saw him in London 2 years ago. He was saying, we're getting your spine to move in the optimal way. And they would talk about the lower spine moving differently from the upper lumbar spine. And the word optimal or ideal. I remember being surprised. And now I know they don't do that. They're just saying we're moving differently.
Sure. Yeah. Well, they've moved
moved on.
And that's the funny thing is that, there's of course corners in which I find myself disagreeing with Pete's work, and just because I'm damn awkward like that. But generally with I think which of those, it's not fair to dichotomize it quite because there's so many similarities, but I then would find myself thinking which has the most positive and negative consequences of the explanation. So even when, say, Stu has provided the relief that's got him the double handshake as they left the clinic with tears in their eyes, and someone's changed their life, and I'm not underestimating that. I'm sure he has that most days. But does that, even when he's had a result, and particularly when he then fails to have a result, do you feel that knowing what we know about the instilling of beliefs or making someone feel like they are a bag of meat that's moving badly, or the idea in which they are somewhat inherently fragile, there is something that sometimes I think that's tough to undo, and I also think that sometimes the Pete O'Sullivan method, particularly when he was particularly into breathing patterns and things, although I don't know if he's moved much past that, but generally that had similar sorts of consequences, don't get me wrong, but there is an underlying collateral damage, shall we say, that comes from those sorts of what I still consider our dated beliefs.
Yeah, I agree. I think there's a subset of people where if we tell them that they're doing something wrong, and then you're kind of setting them up to fail, especially if it's impossible not to do that thing that's wrong, right? That's the issue with the mechanical model, that your disc is damaged, and if you keep flexing, you're going to damage it more, or if you keep doing this habit, and then there's always the issue, and that's just a small set of people who are really responsive to a negative suggestion, right? With Stu stuff, and I would argue with Stu stuff, sometimes the mechanics don't matter at all. It doesn't matter how they move. So if you can't change symptoms with changing movement behavior, then that model is not going to work at all, right? Sure. So what I think is nice with the CFT approach, the biopsychosocial, or any approach that does movement in other areas, then they have other options of just changing movement. They can say, you know what, you're sensitized. Like what I would say is, I don't want to put words in anyone's mouth, but this is what I think of the CFT. You're sensitized to these movement patterns. There's nothing inherently wrong with them. For some reason, they're associated with pain. We're having trouble changing them for you. But guess what? You can still keep poking into pain, and we can just desensitize you in all these other areas of your life. So what they'll do well is they'll look at depression, anxiety, sleep, general exercise, anything that makes someone healthier. And then they say, well, why don't we work on these areas? And that desensitizing here will carry over to your movement patterns.
Sure, and just shifting the context sometimes as well can just make a difference. Which, I agree. It's just I always would look and just think whichever model is broadest, which is closest to true holism and recognizing all the wider variables is always more and more suited. So any model that broadens its reach and its boundaries is always the better. So no, that makes sense, and I think it does sound like you and I are fairly well aligned on these sorts of things. So what I'm going to do is try and walk us towards a couple of things where, from last time we spoke, and also when I was on your course a couple of years ago, I found a couple of things where I thought maybe there's a few percentage points in which we might find ourselves disagreeing, which will be entertaining, because around the time that you were last on the podcast, we had an influx of people that were starting to ask me and whoever was organising the interviews for Physio Matters to find places to disagree with the guests a little more was some of the feedback. Now,
Sure.
it's difficult for us to do that sometimes because really the whole point of the people that we're trying to perpetuate their ideas, that we tend to agree with them an awful lot, and also want to share some of the real meat on the bones of the work. Whereas you coming back on the podcast means we can walk towards some of those areas. Just it might well be that we find ourselves agreeing, but in case we don't, it would be interesting. Now, under the principles of when biomechanics matter, which is something that is a number of really important slides of your work on courses, but also something you've talked a lot about on other podcasts, including ours. You mentioned high load situations are when they really do seem to matter, when people get to a tissue capacity in which it breaches their threshold and therefore tissue might break down, such as an ACL in a cutting task, or if you jump off a roof, you're better off landing on 2 feet is an example you use, and all completely reasonable. Now, where would you sit on the case of it being relative to each individual? So where does that lie within your model? Is it just in general high load situations as per mean values on the physics, or is that something that is particularly pertinent to each individual patient?
It's usually individual, because even when you look at with the ACL tear stuff, people can have a big juicy ACL and they could handle those high loads. If you look at this number always sticks in my head, but it's the Myers study, where the people who had a high knee abduction moment, so that it's like the ground wants to create knee valgus. When they did a drop jump, and I know a drop jump doesn't always predict, but it's still the same idea. Those who had a high cam, they had a 6.8% chance for injury risk, right? And those who didn't was like 0.4%. So even though it was only 6.8%, that means there's lots of people with a high cam who don't get injured, right? So you can have high loads and still not get injured. So there are individual variables that are really important here. So it just comes down again to the fact that adaptability is finite, right? How well we adapt to the loads, and we don't know with the person in front of us how well they can adapt. So it's why I still like to read the pragmatic research, which says, try to avoid these movement patterns in these situations, and we see that they can help. We're not really sure why they're helpful. Sure. I'm cool not knowing.
No, that makes sense, and it could well be, particularly on this one, that maybe we don't find ourselves disagreeing as much as I maybe wondered. But there are certain circumstances, and I remember even maybe using this example on your course, where let's say someone who is generally deconditioned and hasn't then done any formal exercise for a long time, maybe potters around, walks a dog around the block for half a mile every other day, but generally then finds themselves late for a bus and breaks into a jog for 200 meters to try and catch said bus, even though haven't run for 10 years, which is a completely feasible case, certainly over here. Yeah. I don't know if you're sometimes a bit of a fitter bunch over in Canada, but generally that's a fairly feasible story. I see that patient an awful lot. Now, in those circumstances, if she then was to, let's say, tear a meniscus doing that, what's your sort of position on the fact that she would have had more propensity to that injury than, say, you or I?
That's totally consistent. Yeah, because I mean, this is Sue's old stuff. Injury occurs when the load on the body exceeds its ability to tolerate that load. So we just have different. That's the whole idea of movement preparation. You want to be able to prepare yourself to match the demands you're going to put on yourself. So biomechanics, another area that biomechanics matters is when you lack that preparation, when the imposed demands exceed what you can tolerate. So that's why I'm such a proponent of movement quality is probably less important than movement preparation.
Right. Okay.
All right, where you can have funny movements as long as you've slowly adapted to them, which goes back to the disc idea.
Sure.
People can have these high load flexion cycles as long as they've slowly adapted to it. And then again, it goes back to the question, so what if a tissue isn't good at adapting? So going back to the ACL, I think it's such a neat idea. If you slowly expose people to knee valgus under heavy loads, do you actually put load on that ACL to make it thicker and more resilient? that would be the debate. I'm not sure that you can actually do it. I'm guessing there when we tear our ACLs, we just go. There's so much load; it just goes beyond anything that anyone could have the ACL prepare. But that's the question. Like if you want to do the thought experiment that you want to think of.
Yeah, and I think I'm gonna try and drag you towards that thought experiment regarding what might be an upper limit when it comes to people's adaptability on a few different tasks, and we'll drag it up to upper limb as well on that, I think.
Yes.
But
so if you think that your preparation can't increase that upper limit more than the potential injury mechanism, then that's when we avoid. So that's the question: expose or protect. So you protect when you think there's an upper limit. Or we do this in the course. We do like a case study. Like when do you want to protect something or avoid? So if Ian was here, Griffiths, and we were working in the foot, and so there's this idea you can start doing something that hurts and the body will slowly habituate and it'll heal and adapt. Well, there might be some cases where our ability to adapt is limited. So say you have like diabetes or Charcot-Marie tooth or like leprosy, that tissue to adapt is compromised, or the tissue itself, like sesamoiditis or metatarsal pain or Morton's neuroma. Like those are cases where those things just kind of run, they're just slow at adapting and they stay sensitive forever. So those are cases where you say, well, we could expose a little bit, but in order to keep doing the things that are important to you, we have to protect. And then you wear like a flat bottom shoe, like a Hoka or something like that, and try to, not load. Does that seem fair?
No,
like
that does. It's totally reasonable. Yeah, and I think I'm gonna probably come back to that upper limit question because I think there's so many interesting examples on that. But it does make sense. And just for the listeners that might be interested, I've just realised I've not mentioned that Greg won the Twitter Physio Matters Champions League votes, so various rounds of sparring that went on, and then we ended up with a final between Greg's podcast and Ian Griffiths' podcast. So what we're going to do is we're going to put out a podcast, hopefully we can put something together where we get Ian and Greg on the same call and talking around lower limb biomechanics, which will just be a full geek fest, but we'll do that at a later date, so I forgot to mention it. But before we do go into some of the details on the upper limit and how adaptable different parts of the body can be and different systems, different characters, can we first talk about the lower limit that I was sort of referring to with the deconditioned patient? Because I think it's important to talk about what someone's baseline would be, or our assumptions of their baseline, of their lower limit, because it really does make it relevant for how we reload someone, or the advice that we might give an otherwise pain-free and well person that's wanting to engage with more sport and exercise, just such as the dosage that we give them. Because our intuitions, based on what we know now, is to really encourage people to exercise. But we now know there's been a proliferation of things like high-intensity workouts and things that metabolically there's a good rationale for, but we also see some people break down very quickly when they start doing jump squats before they can squat. So how might we best frame the lower limit and get an understanding of someone's capacity without having to really creep them forwards with exercise, which makes it boring for them?
Oh, well, I can't answer that.
Tough luck. Let's play that thought experiment out. Like, let's just think about it.
No, because what you asked there is, how do we choose the best exercise and the right dosage at the right time for everybody, right?
No, but I just mean, might we have some sort of variables that we can play with regards to understanding someone's. I mean, we'd obviously go through it as thorough as we could regarding history and someone's general. We're not talking about people with, say, diabetes or leprosy. I do enjoy the fact that you use leprosy. I don't know if you see many lepers in your Toronto clinic, but good example. But just generally, apart from those, do you have any sort of telltale tricks and tips as to how you find yourself pitching the dose on a general level?
I was influenced like 10, 15 years ago with the minimum effective dose stuff. There were a lot of researchers out of Queen's University really doing that waist circumference research. Yeah. And their big thing was you can get a lot of health benefits by doing very low amounts of work. And one of my professors 20 years ago was into lifestyle exercise. He was a cardiac rehab guy. He's the one that gave me my my grant application, just gave it to me, and that's why I ended up getting a scholarship. I didn't do jack shit. He was awesome.
Nice.
I don't know if that's legal, but anyways, I spent the money. So, and he would say you can get huge health benefits by doing small amounts throughout the day. And I think we got to give those low level exercise tolerant patients permission just to do a little bit. Like you don't have to go to the gym and do 30 minutes hardcore to get the health benefits. So I think it's finding that lowest amount, 1 to 2 minutes. Like if I have a patient who has fibromyalgia, we do 1 to 2 minutes or 2 to 3 minutes every hour. That's sort of the idea, just little bits all the time,
Sure.
Adding up.
You know,
And
when
then,
when it comes to say a well person that's not, like I say, they're pain free, they've not got fibromyalgia, would
even in the well, even in the well.
but then there is a fair argument though, isn't there, for the fact that we need to challenge their cardiovascular system in a way that makes someone sufficiently out of breath. And I know that would be what we could work up to, but we're being inherently overprotective to work on a minimum dose when someone wants to really instigate the getting back into exercise, and we might miss a window in which we can try and motivate them to start exercising, when there are plenty of examples where someone takes everyone by surprise by being able to run every day for a month even though they're obese.
Yeah, I wouldn't be against that. I would just start slow, and then every now and then say, if you want to sprint, you're allowed to try. Nothing really bad will happen if you do 10 to 20 seconds of sprinting and then try it again in a couple days. I always give those permission. You can try everything. You're robust. You're going to be able to tolerate it. You might flare up, but it won't be that big of a deal. So I put like really broad this is what I'm thinking of, just the patients I work with who want to start running, that they're allowed to start that. But usually we do 4 to 6 weeks of just slow stuff before you do any high intensity. That seems to be the rule of thumb. I don't know if you're going to lose anyone because you didn't do that.
No, for sure.
I'd be more afraid that you lose people because you push them too hard and they hate it.
Yeah, that's true. I mean, there's going to be more. The more people will fall off the upper part of the scale rather than the lower one. So I do see what you mean there. That makes sense. So we'll go back to some of the interesting stuff on the upper limit. One of the things that was really alluring for me to think that you and Ian could facilitate a conversation. Not that you'd need me. I may probably end up leaving the call after half of it because you'll just be chatting away. But you and Ian getting on a podcast would be that generally there is where the upper limit is various parts in the body is contentious. How much can the body adapt in a direction, even in healthy individuals, and how someone's structural predispositions to their foot shape, type, their inherent sort of ability to their physiological health, for want of a better word, all these variables will play a part, and a lot of these variables will end up being to some degree a mystery in many ways. We don't always know. Surface architecture of a foot isn't always hugely representative of what might be lurking beneath, different at the foot compared to other body parts, but certainly other parts of the body. We won't understand all the variables in play when we're having to make calls on someone's adaptability. So do you feel that in your experience of working in this model, shall we say, for a while, have you come to recognize certain body parts, certain conditions, certain characters that might find themselves with a lower ceiling than others? And if there are any examples, could you give them?
No. In terms of anatomical stuff, nothing at all.
Yeah.
I don't think that there is anything there. I certainly haven't seen any trends.
So you don't think you don't really buy into, like, particularly there's a certain limit on Q angle that we need to be mindful of with PFJ. There's a certain predisposition at the hip that makes someone then more likely, if someone's got dysplastic hips, they are not going to be any less likely to tolerate internal rotation.
So I'll see hockey goalies who have no internal rotation and they do the butterfly. That's where you go into valgus the whole time. And they have no hip internal rotation at all. They just can tolerate it. Like I have sensitive hips from a long time from running, and they hurt when I started doing gymnastics again, doing round-offs, and I just slowly did more round-offs. Like there was nothing to fix. I'm totally fine now. It took me 4 to 5 months, a trial and error. But I don't think that's the whole screening idea. I don't think there's any ability to do that very, very well.
Yeah.
It's all based on symptoms. That's it. It ends up being simpler. It's just symptom modification and then slowly changing over time.
And when someone's then had a, I mean, I want every bit of me wants to just agree with that narrative, and I do understand where you're coming from with it. But I just think that there's this perfect storm that can happen, particularly once we bring a previous injury into it, where someone might have a femoral acetabular impingement that for
Yeah.
that just does means that they're not suited to being an ice hockey goalie, or they find themselves, no matter how slowly we adapt them into that, no matter what training patterns we try to use, they may have
Yeah.
a structural predisposition, especially coupled with a
Absolutely.
poorly treated previous injury.
You have no idea until it's too late. Like you don't know that's going to predispose them to it until later, until you try.
Yeah.
So I would be so worried about telling people this might increase your injury risk because, in that subset of people, that will increase their sensitivity.
So it's just never worth scarring them with that knowledge.
Yeah.
Now, where would those predispositions most lie, though? Because I mean, I'm sure I'm trying to think of. I don't want to totally bastardize some of Ian's best examples on this, but there are certain, say, different people with different levels of sort of supination resistance, or different foot types or foot shapes and things that might mean that if you held a gun to Ian's head and said you've got to pick which of these two people ends up with tib post tendinopathy, he'd be able to hazard a good guess, because even though both might never, that if he had to pick one from his experience and his understanding of the mechanics and the physiology, means that there will be natural predispositions to someone's biomechanics. In those circumstances, do you buy into that at all, or would you apply that elsewhere in the body similarly?
I buy into the fact that it might happen, that it might predispose them, but you have no real idea who that's going to be until later. There's just too many factors going on. So there's no point in talking about it, because it would be like Ian's paper with Brad Neal in the pronation, right? Static pronation. They said that it was, we talked about this 2 years ago, that it was a significant risk factor, but it wasn't an actionable risk factor because there was no cutoff.
Yeah.
Like the difference between the two groups, there's huge variability across the groups, so you would have no idea how much is too much navicular drop. And then the difference between the groups were fractions of millimeters. So the research is good. I mean, they're great at that stuff, but it just doesn't help me do anything. It's not an actionable risk factor.
Yeah,
Right,
I think that's the thing. The variables at play are difficult to interfere with. If it were to just on a thought experiment, then if we've got two runners running exactly the same mileage, let's pretend that they have every other variable in line. They're the same age. They've got a very similar history, and then they were there, and we did a few tests, and one of them had a inherently higher sort of pronation moments on the subtalar joint, for example, and was and that was the only variable at play. Would we be in a situation where we would look at that and we wouldn't be able to work out, even if forced to? You wouldn't take a punt on which of those two athletes would be more or less likely to develop any particular injury in and around the foot?
Yeah, you might, but it might be one of those things like the number needed to treat would be 50, right? It's like that paper by Chris Barton and Ramskopf. So they did a hip. Ramskopf was the first author, and I talked to Chris about that. So everyone for a long time was saying runners who have knee pain are more likely to have weaker hips. But then when you looked at the prospective stuff, there wasn't. If you had weaker hips, you weren't more likely to have knee pain. And then Ramskopf came in and said, you know what, maybe we were measuring hip weakness wrong, and they did it like faster. I don't remember, but it probably was like 60 degrees, in a KinCom or a Cybex. And they're like, yeah, okay, there we go. Prospectively, the runners who were a little bit weaker in hip abduction were more likely to have knee pain. But then when you go look at it, you would have to put 32 people, I think, into a hip abductor strengthening program to prevent one injury.
Yeah. No, that's fair
So
enough,
to
which
me,
makes
what's
it not
actually
practical.
here,
Yeah.
well, no, how I would take that, or the someone with the high calcaneal eversion moment when they run, and someone say, oh, well, you're a little bit more likely to have, medial tibial stress syndrome. Well, how do you end up preventing that? Well, you do strength training to increase your tolerance to those loads.
Yeah.
So why wouldn't we just do strength training on everyone, since we can't be sure? So we just treat comprehensively,
But yeah,
which
yeah,
is exactly what we do with the FEED 11.
because
The
it would
whole
never.
team gets the FEED 11 for ACLs.
It
So we
would
can
never
sell it
meet
in
the
30.
threshold. Yeah, it would never meet the threshold for
Yeah,
you to individualize it to an
yeah.
extent because we know the consequences of that individualization. So, yeah, I'm with you. I mean, I really tried to force it in there, as you probably noticed, but yeah, we can't disagree on that.
I
Fair enough.
I wrote a paper on that saying, like, maybe if 'cause I had equipment that could measure that stuff, maybe if you see more pronation, you do those exercises, but you should probably do those exercises anyway for performance and because they might help.
Yeah, no,
So you just comprehensive.
comprehensive capacity, as you've often said,
Yeah,
is
exactly that
a
bullshit,
smart move.
bullshit. Trademark TM.
TM, sorry, yes, of course, immediate reference.
And
Now, what
of
that
course.
then, a slight deviation then from that. What's the most common misrepresentation of your views and your work? And you're pretty
Everyone
unflappable.
always thinks I'm taller, except when they meet me in person, like
Yeah,
Tom Cruise.
that's not a misrepresentation, though, is it?
No, I'm
You're a
sure.
munchkin. You've got a taller looking face. People are then surprised and somewhat disappointed that I'm not that I'm not a Chinaman and that I'm like 7 foot tall. So yeah, people say I've got a short looking face, which I don't know what that means. But yeah, apart
No,
from that, which
the biggest misrepresentation is like, what do you got? You just talk to everybody? Even my wife, she'll make fun of me. You're just gonna talk to everybody? I'm like, no, I love biomechanics. Like usually everyone gets some sort of physical intervention, So I still think biomechanics is important. I just think that we have to keep questioning it to get better at it, to find out when it's really important, and then at the same time when it's not important, and then the most important not important thing would be like, when do you absolutely not want to talk about it, because talking about it might actually increase someone's risk for prolonged pain. That's where I think we have to get better. So that's the misrepresentation, that I just talk to my patients and don't do anything mechanically, which
sure,
couldn't be. And I don't get it. I go out of my way to talk about biomechanics. The whole first day of the course is biomechanics.
yeah,
It's just reconceptualizing it.
sure. Well, I mean, I know that full well from having been on those courses and talked to you at length, both on and off microphone. It doesn't really make sense to me when I see that, or you just talk to people who's suggesting biomechanics don't matter. I know very few people in the world that have looked at this as closely as you have and come to the conclusions you have with completely fair readings, as far as I can tell anyway, with my limited knowledge of the literature and of the ideas that are, everything gets a fair viewing. It's been 2 years since we did that podcast. It's been 2 more years of fighting the good fight, in my opinion. Do you feel you are more or less misrepresented these days than you were back then? Do you feel like there is a turning of any tide?
No, I think, well, there's always the echo chamber, right, of Facebook and social media.
Mm-hmm.
I'm actually seeing, the stuff that I've been saying for 10 years and a long time, and we talked about this, like coming out more often. I'm seeing other blogs that are pretty much what I wrote 5 years ago, and people writing these ideas. I'm not saying they're lifting it from me, but maybe I inspired them, or the message got filtered some other way. So I'm actually seeing this model become really popular, and it's better. It's more fun to practice like this. It gives you more options. So I think it's this approach is being more represented, and I like it. We're seeing it in biomechanic researchers. So that, if you probably remember, we did the course 2 years ago. I talked like an hour and a half about the shoulder and all the research on posture and all that stuff. All I do now is quote that paper by McQuaid and Borstad in 2016, where Borstad still is a great shoulder scapular stability, quote unquote, researcher. who used to do all this stuff and try to stretch the pec minor to put the scapula in the best position.
Yeah.
And now he essentially says, forget about that stuff. Ask it's comprehensive capacity. Ask the most out of the scapula. Make sure that it can tilt, that it can protract, that it can upwardly rotate. Make sure that it's strong and that it has great flexibility. Make sure that the rotator cuff is strong and has great movements, and you have lots of options. Like, it's pretty fantastic. And you're seeing more and more biomechanical researchers doing that stuff. It has nothing to do with me. I think that's just what you get when you look at the research, where you get so freaking confused because it seems like it's so complicated. But once you go through that complexity storm, you come out, like the phoenix. You're reborn.
I think that's the thing as well. Is it is incredibly tricky to see the wood from the trees on that stuff, and people like yourself and the researchers you mentioned tidying that up for us mere mortals is incredibly important, because it's easy to get bogged down in some of that data, and to make sure it's parsing out and representing things fairly. Do you feel that the pushback is any quieter these days?
Yeah, I don't see it as much. I think a little bit, but that's because they might have some sort of financial or other interest, or they're young and they've been really, really swayed. But I've often seen like people come and send me an email a couple years later where I try not to be too mean or confrontational, and they'll thank me for stuff. So I often see that. And this model practicing like this, it doesn't mean you don't care about biomechanics. It means you can take that. Like, I would still take a Stu McGill course again. I would still take a Mulligan course. I would take a strength and conditioning course on powerlifting. This framework lets you see another way of how to use that stuff, where you don't get caught up in their philosophy. Yeah,
you start to integrate it and pass it out. I think that there's some. I mean, you've always said that, and I do admire it. But there's also a degree of triage where people have to look on and think, well, whilst I might find myself taking 2 little tidbits away from that 3-day course, it's not therefore worth my time and money. So there are certain things where I think, whilst it being a polite soundbite, I don't know how much you would necessarily spend your time going on a Mulligan course, for example, to find out stuff that you might be able to integrate. Oh, that's a cool technique, but you're not just being polite in that direction there.
No, I would probably take their level ones. I think the simplifying biomechanics usually says you don't need a level 2.
No, that's fair enough. You've seen the footage of the Brian Mulligan stage show from iFOMT, I hope.
No, I don't know if I have.
Oh well, I'll send that over. You'll have to brave that sometime. But yeah, that's the stage show is not me mocking it, by the way. That's literally what happened. But anyway, we digress. It's one of the things that I've always found interesting about your work, and particularly since we spoke 2 years ago. It is clearly tempting for people to get carried away on a theme. I think we
were drunk by this time in the podcast 2 years ago.
Yeah, well, you're wrongly assuming I'm not drunk now. But yeah, I'm no more or less drunk than I was then. But yeah, that was good fun. I always laugh about that, because it's the only one we've really done with any background noise, and some obviously plenty of listeners didn't mind it because it went crazy. But yeah, Charlotte really was irritated when she was editing it. She couldn't really concentrate on it as easily, so she said never again. And I've certainly taken her lead on that. But maybe next time, maybe part 3 will be in the pub once more. But yeah, I'm already slurring. It's often tempting for people to get carried away on a theme, and they propagate new myths in place of old ones. So examples that I remember us talking about in the pub, me, you and Matt Phillips, me and Matt, I remember sweating and scratching our heads trying to keep up with you. But the idea that stretching never changes structure, posture never matters, manual therapy doesn't work, doesn't change anything, doesn't do anything, even briefly. So are we pedantic to insist on better, more nuanced positions that respect the alternatives? Or do you think that some of the more radical nihilists that do suggest such dogmatic positions on things in a different direction, do they serve a purpose because it's the only way to move the needle? So we're talking about a more, how do we pragmatically instigate change sort of argument. So what are your thoughts on that?
Well, we are pedantic, but we're right. I mean, the stretching one's funny. I just laugh at that, because that whole saying it's all neuro and stretch tolerance. Honestly, that's since '96 that we said that stuff. And then suddenly someone stumbles across the research paper in 2011, and it's like, hallelujah, did you guys know about this stuff? Yeah, if you're up to date to begin with, you wouldn't be such a surprise dimwit. But anyways, uh, yeah, we should, if anytime you think you have a revelation, go and challenge that revelation, like in the stretching, go challenge your belief about it. Because that Wepler and magazine paper, that's the one everyone loved. She totally ignored a massive amount of research that said the opposite of their belief. And it was pretty horrible. And that's the problem with narrative reviews, is that you can write whatever you want. It's not a true systematic. It is just a blog. Yeah. It's research, quote unquote research. And I have a few of those research papers, but I had an agenda when I wrote them. And that's the idea. It is just a blog. Like, that's not primary research. But anyways, yeah. So, but you're probably right. If you do want to change people's beliefs, if you think that's necessary, you probably have to take a more extreme view to challenge it and to get noticed and get people to talk about it. It's unfortunate that, like, the middle ground is often correct, but that isn't as interesting.
Yeah, I mean, the conclusions are often just as edgy. Yeah. I mean, it's like the stuff we're talking about now, particularly the stuff we've talked about before, and most of the stuff that we ever talk about on Physio Matters, it's hardly mundane. I don't think that many people listen and don't take anything, at least a new angle. It might not be a big reveal, but generally, I don't think it's any less interesting. The conclusions aren't any less radical. It's more reasonable in how it got there, and it gives fair credit to the other side. So yeah, I'd rather not blow the doors off. It's sort of evolution over revolution type thinking. But one of the downsides to it, though, sorry, I'll let you come back in. I know I'm wittering on, but one of the downsides to it is that and I think it's fair. I don't think it's sufficient to really change my views on this pragmatically, but the other side doesn't come at it with similar charity. So go on.
I agree.
Yeah. So
too bad.
What do we do about that? Because there's this charlatanism on the other side that's not necessarily playing fair. So we look like sometimes mugs by trying to parse out the good parts of their arguments.
Yeah, let me tell an anecdote here. So I had a participant in a course take an SFMA class, an FMS, nice. and I like those guys. I wish I'd like to talk to them. And I wrote they're famous for saying, never put strength on dysfunction.
Yeah.
Right. So if you have a poor movement pattern, you shouldn't strengthen it. If you can't touch your toes, you're not allowed to do a deadlift. And so they referenced. They read, all right, I've heard that, and this is all secondhand. I've heard that there's a blogger out there. That would be me. I'm just a blogger. That's how you insult people.
You're a podcaster. You should have insisted. No, I'm a podcaster.
Well, I wasn't there. That says you can put strength on dysfunction, and we're here to say that's totally wrong. So let's just move on and forget about that stuff. What I wish what they would do would be like, okay, here's what this guy said. Here's all his points. He's either misrepresenting us, some of them are irrelevant, or here's some that are kind of close, and this is why he's wrong, and this is why we have our opinion. And imagine how much better the students would have been from getting both sides of it, and then having these great researchers and thinkers at the SFMA, challenge what I was saying. It would have bolstered the SFMA, because I still think there's utility in it, just for another approach, and the FMS. Like, I wish that there was more of that stuff online, where we're like engaging in debate, really, like, not just trying to prove your own agenda, which of course I do that too, but just trying to get ahead would be the idea. You just have to go in with that mindset that you're open to changing and open to learning. But you're right that I find that you don't see that as much, and it is disappointing.
Yeah, I think that's, and also it can almost look a bit forced as well. That at times we might. I had a circumstance here where the argument against some of my sometimes scathing remarks in the direction of someone like Kelly Starrett, for example, by the time they've stop saying you've not seen the full body of his work, which I find a really frustrating argument, because it's just like, how many times do I have to read everything that's ever been written and hear everything that's ever been said before I qualify for an opinion on this stuff? But generally, once they get over that, it's usually the idea that, well, we're all trying to sort of perpetuate movement, and it's all just different ways to get people moving. I find it really awkward apologetics, because essentially, I mean, I think one of my friends characterized it when I was ranting about it one time as saying, well, it's the argument that even Hitler was nice to dogs. And whilst I don't like to evoke Hitler much, it's the idea that trying to give credit where it's due can't go too far. The idea of thinking that everything has to be balanced and we have to be excessively charitable. I'm not going to give people that much credit for encouraging exercise in this day and age. I think that's a fairly basic entry level. And so generally I do encourage, we just want to talk it out, but I think that those conversations struggle to get off the ground. You can't get dialogue unless you've got goodwill in the first place. And I have some sneaking suspicions that just doesn't come from the likes of the people you've mentioned.
Yeah, perhaps, but then I would still argue that you can engage because there are people listening besides just I just had a debate online, and I knew that neither of us were really, I might have changed my opinions. That's not true, but I was pretty sure that they weren't going to change their opinion. I was like, why am I doing this? And I kept doing it because I knew that later I found out that people were listening and reading. So I think there's still value, maybe not with the person you're debating with,
sure,
but with the other people
is that
a
text back and forth on social media, or is that something that
it was on Facebook on Scotty Butcher's page about therapeutic exercise or corrective exercise and that stuff.
And glutes firing and all that jazz. I think I might have stumbled across that. Yeah, if there's a way in which we can get a public link to it, then I will post, because I think that was an interesting back and forth, and I've seen many of those sorts of occasions, which brings me to my next question, or next sort of topic. I can't necessarily think these are questions. It's just a chat as ever. But that one of the things we've already sort of mentioned is you and I tend to work on a variety of angles to try and cut through with ideas, and you've really usually I'm passing on second and third hand information, but generally there are sometimes ways in which we manage to upset those who crave the traditional formal channels in which education has had to be perpetuated over the ages. Do you think we can inspire behaviour change while still being credible? Even though others, as we've mentioned before, are deluded at best and charlatans at worst on the other side? Because you and I try and use satire, use humour, be as human as we possibly can be, and come at things from multiple different angles, whereas some would argue, no, put it into print, get it peer reviewed, and formalise your tone across every capacity. Where's your position on those sorts of factors?
So that's just a knowledge translation debate, and I'm pretty sure that I remember working at a university as like a program manager, and they were really working on knowledge translation, and they wanted their research to do more, and they know that it's not just publications. That's just one start. It's getting it out there as well, and it's not just going to conferences. I used to be chastised because I never go to conferences and present my research. I didn't like the idea that it would go too far. All they do is promote themselves and not do any research. But no, you have to find as many channels as possible. And I like, that's why I made that joke about the Lehman Initiative.
Yes, and tell the listeners about the Lehman Initiative. It's a great example.
So it was just one day I saw something on the internet and I started laughing, and I was like, and it was just someone selling a simple exercise program. And I thought, holy shitballs, like, talk about taking like the simplest thing and just adding complexity that was totally unnecessary and just saying all these things. So I did this off the cuff video with my 3-year-old daughter, Mimi. And I just made fun of her improper movement patterns and all the dysfunction that she was having. And her poor squat patterns. And some of it, it's odd because some of it would sound, and I said, this is the Lehman Initiative, and what you have to do, especially if you're a chiropractor, you always introduce yourself as Dr. First Name. Hi, this is Dr. Greg of the Lehman Initiative. You don't know how messed up you really are, right?
Yeah.
Like,
yeah, never underestimate how broken you are.
And that got like 20,000 views in 2 days. I could do like a 3-minute spot on the skin fascia frictionless interface and present some literature, and that'll get, maybe 1,000, a few thousand, 20,000. And it still got it was just another way of saying a simple message. Just a different way through satire and being and it was so over the top ridiculous. I didn't feel like it would be offensive.
Yeah,
It,
I
it,
think
I
that's
think it
what's
was too ridiculous to be offensive.
well. It's funny because good satire touches us in places we'd rather it didn't. That's the whole point, though. I think that's where people sometimes just seem to be far too dry on these matters because there's this
Yeah, I
air of
mean,
supposed.
Eminem is
Go on, sorry.
Eminem is famous for saying a little truth is said in jest. Like you gotta.
I think one of the weird things is I think there's this. It's a bit of a myth, really, in itself. This air of professionalism that somehow means that we have to be less human, and there's a fine line, and I think that sometimes people do take the piss on that, really, and they push it too far, and they become somewhat if you're mocking things when chat would do, or you end up finding yourself ridiculing something within 2 sentences when you've clearly not understood its full premise, then that's verges on unprofessional because it's just simply making fun, and it can err towards bullying if the mob joins in. So I do think there are lines there, and I'm not an absolutist on these things, but certainly when I look at that video, which was a complete rip-off of Sophology, by the way, which is my TM. I can't believe you did that. But yeah, generally those sorts of things where there is people know what
all that Sophology stuff. I still don't even know what. Every time I Google it, I find some sofa company from New Jersey.
Well, that's the point, mate.
I was out of town when that blew up, so I don't even know what the hell that's about.
Well, yeah, but you wouldn't understand. You've not for one, you've not been on the course, and you clearly aren't sophologically astute, so you wouldn't understand, and that's fine. And we'll talk about it another time. But generally, those sorts of things they are going to get people's backs up sometimes, which is to some degree a side effect of the point. Is that sometimes things do get carried away, and there are things that are completely ripe for banter, and really it's like you say, one of many tools, and if it was the only thing that someone like you or I were doing, then yeah, there'd be people that would be frustrated. I think that there's probably better places intellectually to do things than just have physio come comedians. But if it's one angle, then I think it's got to be fair game, and I think that people need to really open their eyes to new media, to the world, to social media particularly, and to realise that we've got to cut through in different ways, or we're going to leave whole generations behind on this. And you're really doing that. You're breaking through with it. What's the sort of case in which how might we measure any successes of some of these movements, shall we say, or I think the movement for movement, or the idea of comprehensive capacity, or the concepts in which we rationalize sensibly when biomechanics does and doesn't matter? How might we understand when the pendulum has swung sufficiently for us to stop ranting or mocking in that direction?
Oh, good one. How do you know it's working? Yeah. I think one aspect would be to have to creep into the undergrad training where you say these things and they're not that popular anymore amongst people who are out of school. So, the leaders in the schools end up changing the curriculum a little bit. And then so when the new people graduate, they're like, yeah, we know that. That's nothing new. So suddenly it becomes less shocking and less offensive, because nothing about it is really new or interesting, right? So it just fizzles out because it sucks and it's not interesting.
Yeah, I think
that would be the idea,
and that's where the entertainment factor does have to play a part, doesn't it? Really, the act of interesting people is got to play some part. I think it does seem like, whilst I agree, I think it's almost a bit ambitious, because the faculties in most Western universities are stacked with people with the credentials earned through traditional formal education. and therefore
Yeah, it's bad.
it will naturally, even the best of characters, and there's some incredible thinkers that I know of that really you get them one to one and you have a back and forth, it's brilliant, but generally the way that they've come to those conclusions has been fairly long and drawn out and somewhat formal, so they can't help but perpetuate that model on their students. That way of, how to construct thought does tend to go through those more formal educational channels. So I think it's a tough bubble to burst, whilst I agree with you.
Yeah, well, students always have to view themselves as the customers. They have to make them, especially in the States when they spend so much money going to and they just treat them like cash cows. I don't like how it's done.
Yeah.
Like students have to say, I'm the customer here. Why are you? And now the student becomes more educated because they start reading more and they go on social media and they read their literature or they listen to podcasts. And now the students start challenging the professors in school, and the students start saying, hey, I'm paying and you're just providing me this old information. Your course notes are 8 years old, and I see that they're from the masters that you took when you went away for a summer to Australia, right?
Yeah.
Like that's the shit that you're giving me. That's where it has to say, like the student has to stop thinking that they're in high school and that they have to be there, and thinking, I chose to be here. I'm paying for this product. You better give me a good product.
Do you have sufficient faith in both the financial market that you're describing, so the market forces that could start to play a part there, as well as the marketplace of ideas being a fair game that isn't co-opted? Do you have sufficient faith in both of those markets, one metaphorical, one literal, that would be enough to shift that direction?
I don't know, it'd be market forces. It would more just be the shame, that for that professor to feel like, I'm being challenged here. I need to do something about this. I was so lucky at chiropractic college. I went to school with those two PhDs, the chiros.
Yeah, sure.
And my masters, remember those? Kim Ross, Dave Bresnik.
Yeah.
And then I went to chiro school, and they were changing the curriculum there at the time. And they did amazing in their little area. Like, so I've seen that small changes can occur.
Yeah, you just need the right characters and the right work to be being sold at the right time. So yeah, there's a few things that need to align, but it can happen, and that's promising. I think one of the things that and I'm not sure whether to do push back if you don't agree, but I think that there needs to be some clarity from people like myself over the fact that being to some degree skeptical of the traditional institutions or the formalized processes that I'm often critical of, particularly on social media, probably less so on the podcast, but that doesn't make me anti-intellectual, and it doesn't make me anti-academic. It doesn't. It's just difficult for me and many in I'm not going to say my generation necessarily, because I really don't associate it with an age bracket or a particular timing. But there's just a sort of mentality that does exist clearly for this podcast to be as popular as it is, and for a lot of the messages that we then share to be as popular as they are. That generally there needs to be a shift in the format, but that doesn't make it any less scientific, any less coherent in a message for educational purposes. And I think that whilst we don't have the regulatory formats, it doesn't necessarily have much difference between, well, if anything, it's just a bit sharper, it's a bit edgier, and it's also a bit more relatable and accessible. So that's one of the things I admit that I've got to do some of the lifting on, really, is to help people to understand that these things don't have to be, they're not anti anything, really. They're only pro knowledge, they're pro education.
Absolutely.
Sure. Well, I think that's certainly where I'm at with the questions. I thank you so much for your time. I know I can see it ticking on there. Is there anything else you'd like to add? Anything you've got upcoming for that you want to try and plug?
Sure. I am in the UK this year. I wasn't at all, and then we just added a bunch. I'm in Exeter. That's in the UK, right?
Yeah.
In June, and then maybe Nuffield. Yeah, maybe right around June as well. We're just confirming that, and then in Nottingham next March. That's where Roger is, right?
Yeah, that's right. Is he going to eventually turn up at a course of yours?
I'm gonna invite him, and then I'm finally in London, like the heart of London, in January. I say I go to London and I just go to the north or south or something.
Yeah, that's right. Yeah, you go into London and then immediately get on a train. No, that's cool. Well, I'll certainly look to catch up with you next time you're about, and also we'll make sure we link to all the various courses. It's still I still credit it as being one of the very best courses I've ever been on, and I've been on many.
Oh, and it wasn't even that good. It's better now. It's better. Oh, wait. You know what's coming out? Is I have a new pain workbook.
Oh, that's right. I was just going to say,
It's
yeah.
and it's free, and it's like 99% done. I'm just doing the table of contents, just the graphic design of that.
Brilliant. Now,
That's coming out. It's the same thing as before, but it's into 4 sections.
brilliant. No, I'm really looking forward to that, and I know that was some
And
work
that's
in
going to be
progress.
free.
Why?
Yeah,
That's another question. Like, what is it? Do you still? I've asked you this question in private before, but it seems fair because you've got something new coming out. Should it be free?
Oh, this like, and it's not pure like if you're honest, and I didn't mean it at the start because when I first put it out there, I didn't have anything to sell. But I mean, it's not purely altruistic. I think it still helps me. But no, because I started doing it free, I've always thought of it as free. That was sort of the promise. I have no problem like thinking that this should be free, and it's just it would be harder to write if I did it thinking that I was selling it. You know, I might do online courses in the future, but this is more motivating for me. Like I kind of this is crazy, but and I would never think this before, but I'm like hoping like maybe like 100,000 copies could get downloaded. Like that's sort of the goal there. You know, I always want to qualify for the Boston Marathon. Maybe I get like I give 30,000 people this. Why couldn't we get 100,000 like patients and therapists to download it? So that's sort of the goal. That's really why I want to make it free. And if I charge $10, then that might cut that 9%. So
yeah, no, I totally admire your motives, and I think that you're on the right lines
not
there.
to be altruistic. That there's still selfishness in there.
No, and I don't necessarily look on and think, oh, you're just being overly like generous there in every which way. I just think that there is something to be said for, I'm a big supporter of you and your ideas. I think that if you were to have even just a basic sort of keep it free but have a donations button, and please do, if you were to contribute to this, then this is what, let's say if every other person chucked in $1, what would you do with that money, and how might you be able to share the ideas further and wider? It would then give you think about what that would mean if you got, I just think that that's one of the things that, I mean, as someone, you're speaking to, so I'm the free podcast guy, right? So I'm not going to suddenly.
That's not a bad idea, like a donation, and I could that into research.
Well, exactly.
Anyways.
You'd then admit
no one's here.
you'd admit to I'm not. This is it. I promise. I'm not trying to turn this into a marketing seminar because I'm hardly good at this myself.
I'm not good at that.
It's amusing because my if my accountant was listening, which he occasionally does, then he'd be slapping me around the back of the head and saying you're hilarious because this is exactly what I'm bad at. So don't get me wrong here. But generally speaking, if you were to have a little bit of, if your work was to create some revenue, then it would be you've essentially, within a few clicks, you might well create yourself a marketing and research machinery that then would only mean that you could scale your work further. So yeah, I just think that you're doing great stuff. Anything I can do and anything Physio Matters can do to support it, then please give us a shout. Thank you as ever for your time, and hopefully we'll get together in the coming weeks with you and Ian, and we can talk about some nitty gritty stuff in and around the foot, ankle and lower limb.
Yeah, totally. Thank you, Jack.
Cheers, Greg, and we'll speak soon, mate.
Bye, everybody.
Absolute pleasure as ever to talk to Dr. Greg of the Lehman Initiative. I think we covered most of what's been sort of lingering in my thoughts as to where me and Greg might find a place to disagree. Turned out we couldn't. I mean, despite everything I tried, it's something that really I do think he's got a really well-rounded sort of thought process on all these matters. Although, of course, even if he's one of the closest to the answers, he is far from admitting he knows them, which is always really, really good to see the humility exists across the board. One of the things I forgot to mention, particularly in the last podcast, is when we've looked at it, and a few people have been scrutinising the way in which we can share our message, and they've noticed that one of the things that we really don't do is we don't really beg for iTunes reviews or Stitcher Radio reviews or wherever you come to listen to this podcast. And it turns out that really does tend to affect our visibility on terms of rankings and things. We get high numbers, we get great download rates. I mean, especially in the last 6 months, we've had 3 podcasts that have gone beyond 32,000 listens, which is just brilliant, and it's far beyond my wildest dreams of the reach of what this podcast would mean. So if it never grows from that, I'll be delighted. But what we do want to do is we really care about the messages that we're sharing, and we want them to reach people and try and change people's minds, or just give people pause for thought at very least. And one of the ways in which we do that is for us to be more visible on the internet, and apparently iTunes metrics really does care about historic sort of ratings and reviews that exist on those things. So if you wouldn't mind, if you do like what we do, then we really would appreciate a review for you to revisit that system and have a look on iTunes or wherever you come to it, on Stitcher or Android. It'd be much appreciated for you to drop us a line on there. Of course, if you want more from us, if you're interested in supporting us, if you want to keep us free and keep our quality up and stop us being in the pockets of business interest, then we would always appreciate you joining us on Patreon or supporting us on PayPal. Visit choosehealth.co.uk for all the further information on that. There's a donate button for PayPal if you want to make a one-off donation, or if you want to support us on Patreon, we give out free membership account exclusives on there, and we've got some great webinars that are coming soon from Mark Reed on strength and conditioning, as well as some exclusive conversations that I have. And this podcast that I've done with Greg, as you can tell, is really conversational, and I probably talk too much on it, to be honest, so apologies for that. But generally what we're going to do is try and jump on Skype with these contacts that we've met from all over the physio and medical world, and we're just going to try and jump on Skype and do some short-lived videos and podcasts that we'll get out, and that's going to probably be the mainstay of the Patreon content, because that's what some of our patrons have asked for more specifically. So if you want more of that, if you like what we do, then you do feel free, join us on there and throw us a couple of quid, and we massively appreciate it, because times are tight. This is not the free podcast game ain't easy, let's say, but I always do feel a bit cringeworthy when I'm shilling for cash. But it would really make a difference, especially when it comes to what I mentioned at the top of the podcast, which is rather about events coverage. If you really think that we do a decent job of being these pseudo journalists, then we want to get out there. We want to get in the field. We want to talk to more people. We want to be in the room that you're in. We want to go to courses. We want to cover it as thoroughly as we can. And really, these things are any spare change that's given out, as well, much as we do things out of the goodness of the heart and put as much of the the business money into the Physio Matters thing that comes from Choose Health. Really, the Patreon stuff just covers the expenses of people like George Goodwin, who supported me at the Physio Research Society, and Jack March, who went down to the Rheumatology Society. And you've hopefully seen our myth busting piece, which is through our student group. Matt Murray Downing, Owen Cunliffe, Tom Jessen and George Goodwin doing fantastic work for our new student focus group. Find them on social media if you haven't already. But all of these things, I never get a chance to reel off all the stuff we're doing, but all of these little facets, they come at some basic expenses, and I feel cruel if I don't at least find a way to throw these guys a bit of change to cover their expenses at the very least. So please do consider it, and if you do, we'd much appreciate it. But otherwise, thank you for listening. You've been listening to the Physio Matters podcast, discussing physio matters because physio matters. Bye for now.